So this has been an incredibly challenging year. And as the COVID-19 pandemic rages on, it's my sincere hope that today marks the moment where we look back and flag this day, December 14th, as the beginning of the end. The end of the pandemic that has taken too many of our friends, colleagues, family members, and loved ones. By now, we all know someone who has suffered through the disease or succumbed to it. May we never see another year marked by such grief and mourning as we've experienced in 2020. In just a moment, our co-leads of the Cook County Department of Public Health, Drs. Rubin and Dr. Kiran Joshi, will provide the details of Cook County's plan to begin distributing COVID-19 vaccine to suburban Cook County residents. I would point out that the City of Chicago has its own allocation of the vaccine and its own plan for distribution. They will take questions immediately following their presentation. The presentation will include describing how the vaccine will be rolled out in phases and how our plan is based on national public health guidance. The vaccine supply is expected to increase in the weeks and months ahead, and Cook County Department of Public Health will work with partners to ensure that those who are the most vulnerable have access to COVID-19 vaccinations at the very first. Eventually, the vaccine will be available to all Cook County residents who wish to have it. Drs. Rubin and Joshi will speak in just a moment, but first I'd like to introduce Commissioner Dennis Deere. Again, this is his district, and he is Chair of the Health Committee of the Board of Commissioners. Commissioner Deere.
Thank you so much, Madam President. It is certainly a delight to be here today with all of you all. Indeed, this is unprecedented times and unprecedented measures that are being taken. I have personally lost 10 friends to COVID.
Oh my God.
I have personally had 50 friends that was diagnosed with COVID. So this is no laughing matter. This is no joking matter. It is hit home for me, just as it is hit home for many other individuals. On top of that, staying at home every single day is tough on anybody. It has impacted a lot of people. And so we are delighted that we are here today to talk about the vaccine. But let's not be troubled too much or get too excited about the vaccine, because that does not mean that it is okay for us to do what we want to do. We're still not out of the woods with this yet. And so we are delighted again to be here before you. We're happy about this vaccine. Our counterparts will be talking about our plan around this vaccine, but also keep in mind, please, that they have put into, the CDC has put out that several thousands of individuals they're expecting to die between now and January 6th. And so we want to ensure that all of us are around. We want to ensure that our first responders are taken care of first, and also those that are in our elderly facilities. Thank you so much.
Thank you, Commissioner Deere. And next, our CEO, Israel Rocha. We want to welcome him. As I said, this is the second week on the job, baptism of fire for sure.
Good afternoon, everyone, and
Good afternoon.
thank you, President Preckwinkle, for bringing us together to discuss Cook County Health's distribution plans for the COVID-19 vaccine. Today is my 6th day here at Cook County Health, but more importantly, today is a historic day for our country and for our county after a very difficult year. We all saw the images yesterday with hope and optimism of the vaccine shipments leaving the Pfizer plant in Michigan. That rightfully provides us with hope that the end to this very long, enduring pandemic is within sights. But the shipment and the delivery of the vaccine will not stem this pandemic immediately. It is a vaccination coupled with patience that will make the difference for all of us, and that's what we encourage today. Health equity is at the core of our organization's mission, and we cannot talk about vaccination of our county or our country without talking about health equity and how we're going to ensure that vulnerable and at-risk populations are centrally part of that commitment. Cook County Health is recognized across the country and, quite frankly, the globe for its commitment to patient care, advancing medicine, and helping to be able to provide care in the most perilous of times. We commit to protecting and growing that reputation. And that starts with the processes that we're doing here today in this vaccine program for Cook County. You will hear shortly from Dr. Joshi and Dr. Rubin, who have been working on the vaccine distribution plans for Suburban County. Dr. Greg Hoon, who's presently getting ready for the vaccine shipment, is leading our infectious processes here at Stroger and Provident Hospitals, as well as the Cook County Health direct care sites, reaching almost 6,000 employees. We are confident in our ability to develop a comprehensive plan to bring the vaccines to our employees, our patients, and the community. And it starts with the way that we train and deliver this process. So here are a few of the details for the Hospital Direct program, which is the first one to get started. First and foremost, the employee vaccination program will be voluntary. At this time, we have already surveyed more than 70% of our staff, and respondents have given back affirmative commitment in measuring over 70% in the initial phase that they want to be vaccinated. We have identified approximately 1,000 employees in the Tier 1A program. These are individuals that perform aerosolizing generating procedures and/or providers that have high contact with COVID-19 staff. They will receive emails today to schedule their appointments. We will conduct a small pilot of it to administer the vaccine to check our policies, processes, and safeguards within 24 hours of receiving the vaccine. That will likely be on Wednesday, December the 16th. We will ramp up administration to Tier 1 employees starting Thursday and expect to complete this initial group of 1,000 by December 24th. Employee vaccines will take place at times of convenient for all shifts. After receiving the vaccine, they will be observed upon initial administration to monitor potential side effects on site, and then will be provided with a hotline for ongoing monitoring of symptoms. Employees with adverse events who need a day off to be able to recuperate will be granted a COVID day. To assist with reporting, regular reconciliation and reporting via our Employee Health Services to the Illinois Comprehensive Automated Immunization Registry Exchange, ICARE, will occur. All employees will receive a Pfizer card indicating receipt of the first dose so that they will be eligible for the follow-up treatments. But I can say that as much as this is very much about our employees and what we do to be able to start our first step in helping to meet with this end of the pandemic, the success in the overall effort requires more than public health training and preparedness. It requires us collectively to build confidence among those same employees, patients, and communities that this vaccine is safe. The reluctance of many Americans to be vaccinated is understandable. Our country has not always treated every American honestly and equitably, and we must recognize that. And this pandemic has served as an example of the inequities in our nation. We have watched minority communities suffer the brunt of the virus and be impacted most with higher levels of mortality. But the unemployment, food, and housing insecurities that have resulted from the economic challenges are disproportionately affecting these same communities. At this moment, we will ensure that that is not the story for the vaccine program. Our focus in vaccine distribution will ensure that we prioritize health equity, that we take time and resources to educate every individual safely, and that the efficacy of the vaccine is explained to those who need that information. Our team is working through many of those aspects for our comprehensive public awareness and community engagement campaign. They will reach every corner of our county in partnership with, starting with the president, the county commissioners, our board of health, as well as any willing advocate who's willing to work with us to jointly educate our community about the vaccines, their effectiveness, and how everyone can live their lives safely. We will visit places of worship in schools, businesses, communities, centers, to respond to every question that is posed to us. We will conduct town hall meetings and immunization events. We will use mainstream media, ethnic and social media to educate the public. We will build the public trust in every way possible to ensure that everyone knows what is this virus, how it's safe to take, when they can take it, and the process for taking it. We hope that establishing public confidence in this vaccine with our healthcare workers as examples will be part of that process. As we reviewed, we will start the vaccinating process with our employees as soon as the vaccine arrives within 24 hours to ensure follow processes and safety protocols. You will see many of them in pictures and demonstrations in social media so that we will be able to start public confidence that as healthcare providers, as community leaders, we are willing to take the vaccine and know that this is a road to ending COVID-19. Our ambassadors will not only be our healthcare providers, will also be in the communities where we live with church and employees and community members throughout the area. We will deploy a corps of COVID ambassadors across the county to take vaccine to help answer questions and to calm fears. We will show them firsthand experience and examples in the process so that we can dispel myths. We will make sure the importance of healthcare and trust is the important principle in our vaccination program, that health equity is our foremost priority, and ensuring that no one is left behind is the process. Having witnessed some of the grimmest moments of COVID-19 personally, I'm excited that we have reached this point in our nation, in our county, and that we are able to start making vaccine available to our community. I would now like to acknowledge Dr. Rubin and Dr. Kiran Joshi as co-leads of the Cook County Department of Public Health to be able to provide some more information. I also want to acknowledge Dr. Hoon and the amazing team here at Cook County Health who is working diligently to ensure that the distribution of the vaccine to Cook County is a success. And most of all, I also want to thank President Preckwinkle, Commissioner Deere, our board, for their ongoing support, belief, and trust in our system and this important moment in how we make our community safe. And I want to thank our patients in the community for allowing us to work with you in this very difficult time. Thank you.
Thank you. I believe that Dr. Joshi and Dr. Rubin have a presentation they want to share.
Thank you so much, Madam President. Thank you, Commissioner Deere, and of course, thank you, Mr. Rocha, for your leadership. As per Madam President's comments, the Cook County Department of Public Health is the state-certified local public health department for Suburban Cook County. So I want to ensure viewers understand that all of my comments pertain to that area. I'd like to begin here today with just some communication about our current situation. So as of December 11th, our most recent data, Suburban Cook County has seen 151,761 confirmed cases, 2,849 deaths, and our test positivity rate has been floating at about 13.9%. So clearly, these are some very grim numbers. If you look at the graph on the lower right-hand side of the screen, you'll see that our cases, or our case rates, have peaked in November and do appear to be on a downward slope. It is our hope, our fervent hope, that with the continuation of the good public health measures, which we have been promoting since the very beginning of this pandemic, that this positive trend will continue. So to date, our response has been multifactorial across Suburban Cook County. We have investigated over 12,000 COVID-19 cases, including more than 260 cases or close contacts related to schools. We've provided more than 200 congregate settings with ongoing technical assistance and support, responded to over 300 food establishment complaints, and 100 in other workplaces. We've also cited 84 establishments for violations of Tier 3 mitigation measures, and of course responded to over 10,000 inquiries from the public. It is with great pleasure that I sit here today and am speaking to you about the imminent distribution of the Pfizer-BioNTech COVID-19 vaccine. This is the first ever mRNA vaccine, and as a self-certified public health nerd, I cannot tell you how excited I am about this vaccine. This is a new technology, and this technology has really allowed for truly rapid and historically fast development of this vaccine. Trial participants were representative of our population and included 9.3% African Americans, 4.3% Asians, 28% Latinx, all of which were adults 16 years of age or older. Many folks have had questions about side effects. I'm pleased to announce that they were in general very minor and included things like injection site pain, fever, fatigue, headache, and muscle aches. The truly good news, wonderful news, is that the efficacy demonstrated by the vaccine was 95% overall after 2 doses. And again, additional good news, this effect was similar across ages, gender, race, and individuals with high-risk conditions. We see that full protection requires 2 weeks after the second dose. So with 3 weeks between doses, it takes 5 weeks from the first dose for full protection. Much has been made of a couple of recent cases documented in the United Kingdom of individuals who experienced severe allergic reactions. At this point, the CDC is recommending that anyone who's had a severe allergic reaction to any vaccine or injectable therapy should not receive the Pfizer vaccine at this time. This is for safety precautions. As we provide guidance to individuals who will be providing vaccine in the community and certainly within our own health system, we will ensure that appropriate medical treatment is available to manage any immediate allergic reactions. And individuals who are vaccinated will be observed for a minimum of 15 minutes post-vaccination. All right. Many of us have been asking the fundamental question of when will I get this vaccine? CDC and the National Academy of Sciences, Engineering, and Medicine have provided guidance that speaks to this. We will be taking a phased approach to the prioritization of individuals for vaccination. Very early on, we'll be starting with healthcare workers, particularly beginning in the hospital, and specifically those at highest risk of exposure. I'm told by colleagues at the Illinois Department of Public Health that long-term care facility staff and residents will follow shortly thereafter, and by that I mean within the next 2 weeks. The next group will be unaffiliated healthcare workers, and this includes individuals working in emergency medical services. And then in 1B and 1C, in 1B we'll start with essential workers, and this includes a very large group of everything from first responders to individuals that work for public utilities. And in phase 1C, you see that we begin looking at high-risk adults. I do want to qualify those comments by saying that the Advisory Committee on Immunization Practices is expected to meet at the end of this week and issue additional guidance. And it is our hope that they will help us further prioritize those individuals in 1B, so we can best provide this very limited resource. So phase 1A, as I mentioned, prioritized for hospitals. The first wave of this vaccine is expected to go out to hospitals in suburban Cook County this week. We expect that approximately 20,000 doses will be shipped directly to those 15 hospitals. We have worked in collaboration with those hospitals and the Illinois Department of Public Health to allocate that vaccine. And this allocation is based on the numbers of essential personnel that hospitals shared with us and the impact of COVID-19 on those hospitals. Hospitals will then in turn prioritize, again, based on risk to their workers. We will continue to receive additional vaccine weekly, and we'll continue to work collaboratively with the Illinois Department of Public Health and hospitals in our jurisdiction on allocation, distribution, et cetera. As I mentioned previously, we do anticipate vaccine going to long-term care facilities next. All right. There are additional phases beyond phase 1A. Again, we're waiting for the Advisory Committee on Immunization Practices to weigh in here. Phase 2 essentially is composed of any members of critical populations who are not vaccinated in phase 1 and congregate settings such as homeless shelters, group homes, and facilities housing disabled individuals. And of course, in phase 3, where we would be seeing much increased vaccine availability, we would work to ensure, and this would be continuous from the start of our process, equitable access to vaccination services in suburban Cook County. So with that said, I'm going to turn it over to my colleague, Dr. Rubin, for the next part of the presentation.
Okay, thank you, Dr. Joshi. All right, here we go. So the next part of our strategy refers to engaging partners. We need to have partners throughout suburban Cook County in order to achieve the goal of 70% vaccine uptake, which is required, is sort of the very minimum required for so-called herd immunity. And as you know, herd immunity is when enough people have been vaccinated that the virus is not circulating in the community, or it's at such a low level that those that have not been vaccinated are very unlikely to get exposed to the virus and then become sick with COVID-19.
That being said, we need to have as many people vaccinated as possible. As I stated here, 70% is the absolute minimum. And the only way to do that, you understand we have a health department of 150 employees, and we have a suburban Cook County of about 2.5 million. We want everybody to have the opportunity and to have equitable access to the vaccine. We want everybody to be vaccinated ultimately. So we need to engage community partners from the very beginning, even though now we are pushing things out in the very first wave to hospitals. And so our initial partners are indeed hospitals and larger healthcare systems. Eventually, we want to be engaging healthcare providers in all different levels of the community in order to come together to become vaccine providers, as well as trying to reach out to their communities to gain trust, to understand that we need to have the vaccine and that it is safe and it is effective. So our health department will continue to take the lead in coordination and immunizing critical populations and identifying and bridging those gaps in coverage. So as the slide says, we'll continue to do monitoring of testing and our contact tracing, of course, maintaining vaccination data and guidance to refine and update allocation strategies, because this is a process that is not static. It is a process that is iterative and is going to be evaluated and reevaluated and refined as we go along. So we need to be engaging community partners from the very beginning. Alrighty, I don't seem to be advancing this slide here.
I think it's the forward arrow.
Why don't you give her a hand?
Thank you very much. Okay, so a little bit more about partnerships. One thing that we're doing is the health department has a tremendous partnership with the Cook County Department of Emergency Management and Regional Security. Mr. Barnes is here at the table today to represent them, and we are working as partners and have set up an emergency operations center that is involved in receiving the vaccine. We are receiving a certain amount of vaccine directly to our health department, and the rest is being pushed out directly to in the first wave, to our hospital partners. So it's in terms of dealing with storage and distribution and all of the logistical and operational support and needs that you can imagine are in place. We are dealing with an ultra-cold vaccine that has to be maintained at the appropriate temperature. It then has to be packaged if we're sending it out to sites for vaccination, packaged in the appropriate containers with the appropriate cold chain storage, so to speak, and and so also that it's being received and is being used in the appropriate fashion at the receiving end. And so we have a whole operations center that is set up, and we have a whole bunch of processes put in place in order to maintain that. We also have been working directly with Cook County Health and working especially with our ambulatory and community health network to eventually be working with them very closely to set up community-based testing once we reach the phase 2 and 3 of the vaccination push-out. And we are using appropriate epidemiologic data to tell us where the biggest hotspots are and the areas of most need and the most underserved places for vaccines. So we're strategically setting up areas where we can have points of dispensing for vaccination, where we might provide directly ourselves, or that we can work with partners to provide those vaccines. We want to make sure there are no dead zones in the suburban area, where there are underserved areas where there might not be a pharmacy. So we know that that's a place where we're going to have to set up an area to dispense vaccine. And we are right now identifying locations and partners for that throughout the county. Pharmacy partnerships are extremely important, and the federal government has had contracts that they have set up, arrangements with both CVS and Walgreens, and they will be receiving vaccine directly, these pharmacies, and they will be going to long-term care facilities and assisted living facilities to do vaccine on site at these places where our most vulnerable population, one of them, is situated. And they will be doing that in all of them. And we have over 200 long-term care facilities in our jurisdiction. as well as a whole bunch of assisted living facilities on top of that. Also, we are working with other chains and independent community pharmacies. The federal government is hopefully going to be pushing out additional partnerships, and we are trying to leverage ours as well locally. Next slide. Planned locations for vaccines are hospitals, that's the very first wave. Long-term care facilities via the federal pharmacy program I just spoke about. Cook County health sites in terms of community-based testing. And we want healthcare providers and pharmacies, so private providers and pharmacies and small healthcare networks, to please sign up and be providers of vaccine. And we are working on mobile and drive-through sites as probably the safest kind of methodology for vaccine push out in addition to the other plans we have here. Okay, so some key issues. We obviously have very significant logistical and operational issues that are extremely complex in terms of the cold chain requirements that I mentioned, and also how we ramp things up to scale. There are existing inequities in healthcare access, and we are trying to identify, we already know where these places are, and areas in our county, but to understand that that's where resources will need to be prioritized. And also we need to be dispelling many myths and disinformation about the vaccine in order to gain trust and to decrease the vaccine hesitancy that we have been hearing about throughout the country. Okay, and just to illustrate on the map here, on the right is what we call our social vulnerability index, which is an index that takes into account a whole variety of socioeconomic factors and racial and ethnic disparities. And you can see what's circled there in those areas in the South Suburban area and the West Suburban area correspond exactly to where we have the highest density of cases of COVID-19. So we know the areas we need to be concentrating on, as well as other hotspots throughout the county. And just to illustrate this further about vaccine hesitancy, there has been a particular issue with, unfortunately, distrust and understandable distrust about the safety and efficacy of the vaccine. As you can see, about only 50% of the African American population is either definitely or probably getting the vaccine, willing to get the vaccine. But in all groups, including Latinx and white populations, there is significant hesitancy. Anywhere between 50 to 60, 65% of people say that they'll get it. So that means we have 35 to 40% of the population that is quite hesitant about receiving the vaccine. And we need to be focusing on these communities to gain their trust and to understand, working through partners on the ground in those communities, that this vaccine is safe, important, and it saves lives. Okay.
More assistance.
There we go. Sorry,
Okay.
I see. I'm getting it. Thanks for your patience. So a couple of myths. Obviously, there's the idea that this was very rushed and compromised safety. Actually, the vaccine was studied in thousands of people over a 2-month period. And it's undergone rigorous review by a variety of federal agencies and also international agencies. And data has been published in the New England Journal of Medicine, the premier one of the premier internal medicine journals or medical journals in the United States, as well as published in international journals as well. And there has been vaccine planning going on in health departments throughout the country for months now in preparation for this rollout. Also, another myth that's very important that Commissioner Deere brought up is that people who get vaccinated don't have to wear masks anymore. That's not true. Evidence shows that the vaccination will prevent people from getting sick, but we don't know yet if that means that individuals can still carry the virus for a period of time after exposure and transmit it to others even if they are not themselves ill. So we need to continue the masking and continue the physical distancing and continue the hand washing, our 3 W's. Also, a myth about the vaccines having microchips that allow the government to track people. Well, sorry, that's not true. In fact, I'm very glad it's not true. And also to reiterate messaging that we've been saying all along, that whatever information, personal information is collected to push out vaccine, Similarly with our contact tracing, that information is kept extremely confidential. It is only kept within the public health system, and it is not released to any other governmental agencies or private agencies. So in summary, the Pfizer COVID-19 vaccine is safe and effective. Every eligible person should get one. The vaccines will roll out in phases. We've described those phases. We're starting with healthcare workers, seniors, and our most essential workers. Many, many partners will be involved. Please pass out the word, because if you're a healthcare provider, we want you to sign up to become a vaccine provider, and you can find information about that on our website at cookcountypublichealth.org, and you go to the vaccine tab and you look at the healthcare provider information. And thank you today for our comments.
All right, thanks to everyone. And before we take questions, I want to thank Michael Albert and Lissa Trieger for being our sign language interpreters. All right, Nick, where are we?
All right, Madam President, we are going to take reported questions from those who are here physically here first, and then we'll take questions from those over the phone. We'll start with Charlie from ABC 5.
Welcome, Charlie.
Good morning, Madam President. Thank you for having us here this morning. Thanks for explaining this all to us. A couple of questions. First of all, involving cost. As far as the county goes, will there be a cost associated with the vaccination portion? I do understand there won't be anything for the vaccine itself, but will there be for the shots? And also, how are you going to roll this out in the jail system?
All right, I'll start with Dr. Rubin.
At this point, the additional costs to providing vaccine, aside from the cost of the vaccine itself, which as you said is free, is covered by insurance, public or privately funded insurance. If you do not have insurance, we are still working on hoping that there will be actually federal funds to help support individuals, so there will be no barriers to getting the vaccine for anybody that needs it, which means everybody. In terms of the jail system is covered by the Chicago Department of Public Health. It's not under the Suburban Health Department, because the jail and the juvenile temporary detention centers are both within the city. However, my understanding is that the city certainly sees these populations as staff as well as the detainees as high priority for vaccination.
Thank you. Is that your only question, Charles?
Actually, I do one more.
Yeah?
The BBB is warning today about scams involving paying a certain amount of money to move to the head of the line to get your vaccine by mail. Has the county encountered any of those scams so far, and what's your advice to people if someone approaches them and says, I can make you first?
Dr. Joshi, it's your turn.
I would simply disregard that. There is no ability to get to the front of the line, particularly given when we have a highly limited resource that we want to prioritize for our healthcare heroes, our most at-risk populations, and our seniors. So thank you.
All right, Nick, who's next?
Yep, thank you, Charlie. Michelle from ABC 7.
Good afternoon.
Good afternoon.
I have a question regarding what we were talking about in terms of addressing disparities in access for people, especially something that was being talked about over the weekend was what a large portion of our population at the bottom end of the economic ladder does not have access to a vehicle, and how would it be possible to expand administration of the vaccine not just to healthcare centers, but to places like community centers, libraries, gymnasiums? Is that something that's even logistically possible and that you would support?
Dr. Rubin, it's your turn.
Yeah. Thank you, Madam President. Yes, thank you for that question. We are in the process of identifying a whole variety of places for vaccine, whether it's church basements or parking lots, maybe even better, community centers, as well as the whole schools, a whole variety of locations. We are hoping to garner community support where healthcare providers can maybe, will work in their communities, but in places that indeed will decrease the restrictions for individuals to be able to reach those places, and also where they would be in situations or facilities that people trust. You know, whether it's the YMCA or whether it's the local school, because they understand that that is a center of their community. And so we are in the process now of identifying certain places where we would be able to set up some vaccination sites, especially in the south and the west suburban area, as well as in the north. In addition, we are also looking into trying to expand mobile vaccination testing sites that can be set up in parking lots and other like situations throughout the suburban area. But be aware, we have 700 square miles to cover, so we really need partner engagement in order to respond to exactly what you're bringing up about lack of access for people that don't have transportation or are infirm and are not able to travel.
Dr. Joshi, did you want to add something?
No, I think Dr. Rubin covered that. Thank you.
You took your mask off. I thought you wanted to speak. Okay. Next, do you have more questions?
I have one more question. You mentioned that the first shipment will include 20,000 doses. I guess the first part of that question is, does that mean 20,000 just enough to cover 10,000 people? And the associated question is that enough to cover everybody just in 1A, in Tier 1A?
So just in response to that question, so the 20,000 doses are the first dose, so we'll give 20,000 healthcare workers their first dose. It is not enough to cover 1A. It's not enough to cover all of the healthcare workers in hospitals in 1A. So we anticipate it's going to be at least 4 to 5 weeks before we get through that first sort of hospital-based wave. Thank you.
All right, Nick, who's next?
All right, it's Sam from the Sun-Times.
All right, Sam.
Good afternoon, you all.
Good afternoon.
Good afternoon, Sam.
Dr. Rubin, you mentioned regarding the myths that the health department will have to confront to increase the efficacy of the vaccine itself. So I was wondering if you could offer any specifics on what the county plans to do to dispel some of the misinformation and the myths that are out there regarding the vaccine's efficacy.
Yes, thank you. That's it's a tough road, to dispel people's myths about the vaccine, or to at least decrease people's anxiety about it. We have just uploaded a new website related to that. We will be pushing out messages via social media and the usual ways of getting out media announcements. We also are engaging a whole variety of community partners. In fact, through our contact tracing program, we have engaged over 30 community-based organizations to help people understand that contact tracing is extremely important, and we will be able to use that same network to also talk about vaccine, because that helps also with the contact tracing efforts, obviously. And so the idea is to work on the ground with partners that serve and are part of the communities throughout the suburban area to be resources and vaccine champions for providing appropriate information. And we will be getting out toolkits, media toolkits, and resource toolkits for everybody to be able to use that information as well.
Thank you all.
Dr. Israel, you want to speak?
So just wanted to add one quick point on your question. I think it's a very important question on myths, and so what I can commit to you is that across the entire system, from our public health system to our county program to our partnerships to our collaborations, it's important that we remember, and why I'm wanting to make sure this is a critical point. When we spread things that we don't know for a fact, when it's talking about vaccine, these are lives that we're talking about, potential lives that could be lost. And so I think it's really important that we're going to do everything possible to spread fact. And I think the more people that we engage, so we will be very, very committed to ensuring that we reach out to every group that has an influenceable community that they can work with. There are centers of trust that people work with. We're going to be reaching out to them. So, as we said, we're going to reach out to our religious organizations. We're going to reach out to community advocates. We're going to reach out to patients. And the most important part that I would encourage, we can each do our part. If we don't know for fact, if we haven't read it on a website, if we haven't been told by our doctor, by someone that we trust that this is the information, not to repeat that information. So it starts with us, because unfortunately this could be be a life that is lost if we give the wrong information to the wrong individual. So myth and the spread of myth doesn't just start how we deal with it as an organization, it's also individuals. And so we're going to do everything we can to give everybody the most amount of facts so that we can make sure that the most lives are saved. And I thank you for that question, but know that we will be having a very exhaustive campaign that will also ensure that communities that are vulnerable, that are left behind, are at the center of making sure that they get the facts that they need.
Thank you.
All right, Omar from CNN.
Thanks, I have three questions on three separate aspects. One is, are you able to walk through the timeline, one more time, of what the vaccination process is going to look like? And I know the shipments are going to some hospitals directly. Are you aware of any of them that have it yet? Or are they all going to come in fragmented portions?
Why don't we ask one question, answer one question at a time? There we go. I think it's your turn, Dr. Rubin.
The first shipment that's partly coming to us and the rest is going directly to hospitals will probably all be pushed out at the same time. And we imagine that they will be getting notification today of when to receive it. It might be as early as tomorrow or Wednesday, but we have not been told exactly when we're going to be receiving those shipments. They will all be going out to our 15 hospitals in the suburban area at the same time, and they will all be getting their first allotments. And then we will be storing the second half of that initial push out for when they are then able to then continue their first wave of vaccination. We will then also be receiving weekly shipments is what we've been promised after that point. And we are hoping that eventually things are going to be shipped out directly to the places that are going to be administering the vaccine instead of having to come to us first and then being pushed out. And we're sort of at a hybrid model at the moment, but we imagine that things are not going to be coming out fragmented, that things, at least this first initial shipment is going to be pushed out all at once. After that, the shipments might be based on what the need is when they're ready to receive the next shipment.
Sorry, that push out will come from you guys on the initial one.
The initial one is that our 15 hospitals are getting an initial supply. They are all getting it directly from Pfizer. We are, in addition, at the same time, getting an amount that we can then replenish that supply for the hospitals when they are ready to receive the next supply. We have the ultra-cold freezer capability, and these hospitals do not. So whatever they get, they have to use within 5 days. So therefore, they're not receiving their full allotment right away, and we are storing for them whatever they need to be kept in storage until they're able to do that first push out, and then they will get the second push out from us. After that, there will be continuing supplies coming out from the manufacturers, Pfizer and then Moderna. And again, we don't know exactly. This is a moving target. The information changes every day, but we hope that delivery will go directly to hospitals.
And then the other part of the question, since you answered one of them, was how do you expect the an impending Moderna EUA approval to filter into this, to at least what you're anticipating and planning for?
Yeah, we expect the same FDA committee that approved the emergency use authorization for the Pfizer vaccine to meet later this week. And if the pattern continues, then we would expect that the Moderna vaccine would be available to us on the week of Christmas.
Are those your questions?
You good?
Yeah.
All right, Nick?
Okay. All right, we're going to take questions from the folks on the line. I know we have Cranes, BBM, Bloomberg, Evanston Review. Is there anyone else I've missed?
Chicago Tribune.
Okay. And I know I have a question from CBS 2. I'll start off with CBS 2. Israel, this one's for you. Where is the vaccine right now in Chicago area? For the general population, what steps can be taken to sign up to get vaccinated?
Sure. So first, because of security reasons, there's not locations where the vaccine's given. Right. So it will come to our center. We do not have it on site right now, but we are expecting it shortly. And upon arrival, we've said that within 24 hours is when we expect to start giving the first dose. That 24 hours allows us for security processing, both thawing of the vaccine as well as preparing our protocols, our dosing, training our staff, and ensuring that we have the operations ready to give it safely. And so that, I would say, where it's at, really until it arrives for security reasons, as you can imagine, those areas are not disclosed. And then the second question was, I'm sorry?
Second part was, what steps can be taken to sign up to get the vaccine?
So internally, right now, it's gonna work for our staff, and so what we have done is we've sent out a survey to everyone, because it is a voluntary program, who would like to be able to get the vaccine. And we're very happy that in the first wave, 70% of our healthcare staff said that they affirmatively want to be vaccinated. And so upon the arrival of the vaccine, all the eligible staff are going to get a scheduling request, and they're going to be able to sign up. What we are working long-term, as this moves into the community, is that we will be working with the public health department to be able to create processes where individuals can learn how to sign up for that vaccine, and that will be coming once we get through the first phase of 1A with the healthcare providers and the first responders. But eligible parties will be contacted when they're able to come in and get a vaccine by their healthcare institutions.
Thank you. All right, we'll go to Cranes. Crane, do you have a question?
Hi, yeah, thank you. When doses are available for the general population, will the department be working with employers to provide shots to their workers? And if so, are certain industries expected to be prioritized over others?
We are also trying to develop partnerships with especially large employers in order to, especially large employers will have employee health systems, hopefully on site, and if not, partners in the community that provide employee health services, and try to work with them in order to vaccinate their worker population, especially larger employers. This would be very important. And when we prioritize, we are going to be prioritizing once we get through the healthcare worker and the long-term care and first responder cohorts. We also have to be looking at what's called essential workforce or critical infrastructure workers, as the federal government is calling them now. And they will also be tiered and prioritized in that order. And so some of these larger firms and companies might very well fit within that category, and they would be prioritized at that point. But we need to be working on continuing to establish those partnerships with those workplaces, and that is certainly our intent.
Any other
Thank
questions? Yep. Craig Dellamore, good afternoon.
I have a related but off-topic question, so if you want to come back to me, that would be okay.
Sounds good. Bloomberg.
Hi, I'm wondering how you came up with that 1,000 number based on the 20,000 doses that you're getting. Why 1,000 in the first week? And then going forward, will you be providing updates like you do for case totals? Will you be providing vaccination data like that as well?
So this is Rocha. I'll get started with the first one, and then I will turn over to Public Health Department. Those are two different numbers. So the first number was an allotment of what was happening at our direct Stroger campus. And so when we looked at just our hospital as an example here at Stroger and Provident Hospitals, we looked at both. On all the titles that were part of that 1A protocol, which were those that had either high contact or were part of aerosolizing generating procedures. That was what was our initial allotment. The 20,000 that you're looking for is across the suburban response that our public health department is looking at, and they have, each hospital is their own allotment that they're working at. So we gave, the first example was what our hospitals that are part of the Cook County Health System, Stroger and Provident, are looking at. That's 1,000 employees with them within the first wave of employees, and then it expands. And then I will turn to Dr. Joshi to talk about the remaining hospitals that we serve as a public health entity.
Yeah, so two things on this. One, my understanding is that the CDC is working to set up a public-facing website through which individuals can determine where vaccine is available. So some of the reporting that you mentioned may happen through that website. More information to follow on that is what I'm told by CDC. With respect to our program, as with many of our public health efforts, we do rely on state infrastructure in terms of the data systems. And so we would be working with our partners at the state to ensure that we are being transparent with where vaccine was available, how much had been used, and so forth. Thanks.
Okay, just a quick follow-up. Is that 1,000 part of the 20,000 or in addition to the 20,000?
It's an addition.
Okay, so it's 21,000 total for Cook County then?
No, it's 21,000 for the what jurisdictions that we serve. That's Suburban, Cook County, and also for Stroger and Provident Hospital. Remember that the city, and there's a few other jurisdictions that have other public health departments, so they will have their own numbers. But we are coordinating across all the public health departments, and very soon we'll be able to have numbers across the entire counties. We're all getting ready together, so we will be able to share those numbers. But the 21,000 right now is the public health division that we're over and our direct health system as Cook County Health.
Thank you.
All right, the Evanston Review. Good afternoon. Evanston Review. All right, Chicago Tribune.
Hi. So I want to make sure I'm understanding this. When we are rolling this out to the community, the larger community, as you know, Lake County has created a registration system. Do you have plans to do anything along those lines, or are you really going to be relying on individual health systems and doctors to reach out to their patients?
I think the answer is that it's going to be a mix. As we indicated earlier, this is really going to be a team effort. No one provider could vaccinate all 2.5 million residents in suburban Cook County. So yes, we will be looking to partners, including health systems, private providers, pharmacies, really wherever there is existing healthcare infrastructure to provide vaccine, we would want to leverage that. And then, we see our role as finding out where the gaps are, identifying them using the data that we analyze, and then working with partners and our own sort of mobile vaccination efforts to bridge those gaps. We do not have a registration system in place at this time simply because the focus at this point is really hospitals. Again, in collaboration with our partners at the state, we understand that there are plans for a comprehensive vaccine registration, scheduling, administration, and then reminder system that I'm told will be stood up next month.
And this is Israel. What I would add is that we are working very closely, again, with the commission and with the president's office. What we want to make sure that we're doing is that we're releasing the appropriate time when the different phases are eligible. If we get too far ahead and then there's a change between now and the time that the community can register, again, we said we want to make sure that we're giving people the factual steps that they need to take to get registered. So we are being very cognizant that we don't want to create systems that they will then have to require duplicative work or create a campaign where someone feels they need to register. So that everyone's learning in this process, and I don't think anything is wrong in how you're getting ready, but we do want to make sure that we're being cognizant of the timeline. So I would say when it gets to the mass public, we would be, as we get closer, we'll be announcing the education steps that individuals can take. But that doesn't mean that we're not preparing, but we want to make sure that the appropriate steps as the public gets ready for their phase. Right now, it really is tailored to healthcare providers, and every county is doing what they feel is necessary. Here, we are working with the healthcare providers to get them to work with their health staff to make sure that they have the information they need to get immunized.
Thank you. So the state may have a registration system, but not Cook County.
Well, we'll see as the days go ahead. Right now, we're working with our healthcare providers.
Okay. And just to be clear, that 20,000 doses, is that this week that you're expecting those?
Yes.
Thank you.
All right. Before we go to Craig, are there any other questions, on-topic questions for those on the line?
Yeah, this is Dan with WBBM TV. Just a quick follow-up question to the question we asked earlier. We're getting some pictures in from other parts of the country where there are people already getting vaccinated farther from here, and the vaccine is coming from Wisconsin and Michigan. So just curious why we're not seeing it here in the Chicago area since the vaccine is so physically close. But we're seeing it, hundreds or thousands of miles away already.
Hundreds of thousands?
Yeah, I don't know, your guess is as good as mine. They are pushing out as much as they can, as quickly as they can this week, so we know we're going to be getting it within a day or two.
All right. Craig, your off-topic question.
Okay, and thank you. You may know that SEIU Local 73 held a news conference earlier today, and they says that the county is using CARES Act funds to hire potential strike breakers, and also refusing to negotiate while they are, under a possible strike threat, things like hazard pay and adequate PPE. And is there any response to that?
So this is Rocha. What I would say is that I know that our human resources team has been in active discussions with the union on several of their points. As far as our workforce is concerned and expansion of our workforce, what I can say is given all the responsibilities that have come in responding to COVID, whether it be doing a testing program, expanding resources, creating new floors, now doing a vaccination protocol, it has required that we have a temporary but expandable workforce to meet the needs of either absences, operations, or new programs that need to be stood up. They have been part of our response throughout COVID, and they will be with us until COVID concludes, and we all hope we get to that day of normal operations. That's the workforce that we are employing, and that's what we're working on, and we are working as quickly as we can. But as far as negotiations, I know those negotiations are ongoing. There are discussions, and our team is working with them, and that's pretty much where we are on that issue.
One quick follow-up, and that is that workforce is coming from out of state.
Our workforce, we worked with temporary organizations to help us procure that workforce. It comes from many different places that has been able to provide us assistance.
I think,
Thank you.
I think, Craig, we've worked with various agencies to provide us with workers, and many of those workers are from our local community, and some of them are from out of state. I think in particular we're recruiting nurses out of state, yes, because there's such a shortage of nurses in our immediate vicinity. And I would just point out that we have in the last several weeks come to agreements with our Teamster workforce at the jail, with our nurses regarding some of these issues, and our conversations with SEIU are ongoing.
Okay, thank you very much.
All right, I think that's everyone.
All right.
Thank you.
Thank you all.
Thank you.